Good evening all. Please confirm if my voice is clear.
Yes, sir. It's
Yeah, I think you can see me as well.
sir. It's
Fine. So, welcome to this orientation session for Jewel's batch GPAT 2026. So, this is the first long-term batch what we are starting from today itself. And today is auspicious day, many of you know. So on that good note, we want to start batch from today itself. So last 1 month we have kept some classes, but it is like some warm up kind of classes to make you get ready to get your materials. I mean, there are different textbooks, all those things. So officially today we are planning to start the classes. So fifth and sixth, we are allowing all the students as a demo class so that if any of your friends are there, if they want to see what kind of subject we are giving, what quality we are giving, you can refer it to your friends today and tomorrow at 10 o'clock. So tomorrow Upendra sir class will be there on the topic and subject of pharmacology, physiology, all those things. So if any of your friends are willing to join, please do refer to them to attend demo class tomorrow. And from Monday onwards, it will be only for the Jewels batch. And we are starting July 5th, right? So you will be with us till June 30th. June 30th in the sense, by the time the results of NIPER, results of GPAT, it will take at least June 30th. That is what we are expecting. Maybe if they prepone the exam also, there is no surprise if they conduct exam in the month of February itself. So things are happening, a lot of corrections are happening from many things. And last 2 years, if you see NBMS GPAT, last year they have not released the cutoff first. So what they have done is they have released the merit list only. And later 10 days, they release the cutoff and with everything. But this year, they have taken utmost care in terms of the question paper. Some corrections are there, but they awarded the marks for all the papers, I mean questions. And they have given the merit list, how many students attempted, how many students qualified. Based on that, they have released entire thing in a proper way. So we are expecting the same kind of things will happen for 2026 GPAT as well. There will not be any kind of confusion and everything will be in a streamlined position. That one I am sure as of now. Second thing is that there was a lot of confusion related to this GPAT stipend. Who will give that stipend? Whether the AACT will give, UGC will give, or some government other body will give. But this year they particularly confirmed that PCI will be giving the stipend. And whoever qualified 2023 GPAT, 2024 GPAT, they received the stipend. Some of our students are there who are studying in universities, they got the stipend. So no confusion about the stipend. So today the agenda is, we have Dr. Jyothi who takes care of all the academics part here. She'll be briefing you about the subjects, what are the important subjects, and what kind of PG studies you can do, not only in NIPER, not only IIT BHU, what are the other universities available as to pursue your pharmacy or MBA. She'll be showing that slide. Apart from that, subject wise, what are the reference books you need to study and what as an institute we will give from our end. She'll be briefing all those things. My request to all the people is that get your notebook. If you can switch on your video, that will be great. That will be like more interactive kind of thing. If not, it's fine, but don't disturb the class and don't get relaxed with the classes. Maybe you are lying on the couch or maybe sleeping on the bed and listening to the classes. You do it like a worship, right? This GPAT goal, if you are aligning with us with EsPharma education, my request is please have proper attitude and approach towards your GPAT goal, right? So this GPAT exam is very much important in your life. This will change your entire career graph. I always say this to students. God has given us an opportunity for us to write an exam called MSET or NEET, right? NEET in the central level. So with that, our career will be decided whether we become doctor or engineer or pharmacist. Many of the people who pursue pharmacy, they joined pharmacy because they missed the MBBS seat. Am I right or wrong? I need some responses. So the same God is giving another opportunity for us to set out our career, whether to study in the premier institutes of India or just settle at the normal colleges. Now decision is up to you. I can 100% say that GPAT is not tough as of NEET exam. GPAT is nothing but whatever syllabus you are studying from the 4 years, 1, 2, 3, 4, the same syllabus according to the PCI, the exam will be conducted for GPAT as well. So it's not GPAT is separate syllabus, your semester is separate syllabus. If you can put your 100% efforts, whatever you are listening in the class in terms of classes, that will be more than sufficient. Along with that, EsPharma will help you like a catalyst. We will help you what to read, what not to read, where you should not waste your time. So we have a team of experts here. We have Jyothi is there, Upendra sir is there, Basha sir, and maybe Shrikar sir may come in. And we already know Laudu sir. So we have these kind of faculty with us. And Deep Animal sir is there. You have the best of the best faculty in EsPharma education. Only expectation from our side is that please do attend classes consistently. Right? I'm expecting at least 90% of attendance from all of you. Second thing, whatever we are conducting exams at EsPharma, do with utmost honesty. It is not with judging somebody, you got very good, you got very less marks. It is not judging you people. It is judging you versus yourself. From exam to exam, you have to make sure that you are stepping up your knowledge levels. That is what our basic expectation. And as a founder or owner of EsPharma Education, my responsibility is whether students are attending regularly or not. I'll be staying more on the student side. I'll be giving more materials to you. If any class is not understood properly, I'll make sure that the class will be repeated again. And I'll make sure that you will get the best faculty. And I'll make sure that the entire journey of this 1 year, your batch will be completed by December as a Jewel's first long-term batch. But what you will do from January to May till the exam, that is my responsibility. And whatever materials you need, classes you need, I'm here to help you out, assist. I'm like a bridge between faculty and the students. So it is my responsibility to give the best for you. And another expectation, apart from classes and exams, don't follow unnecessary content, whatever is available in the YouTube or Google. The main concern for many of the students, at least this Gen Z generation, is that they are having too much information. They are unable to know how much is too much for them. They are gathering every information and missing their main goal. So whatever given by EsPharma education team, faculty, and as a materials, just follow those kind of guidelines, right? So this is my special request. The mistake happened with our warrior student is that they followed each and everything, whatever available on the YouTube channel, whatever they searched in the Google. So they try to get every information as much as possible, but they have not executed it. So that mistake, it should not happen. Whatever notes you are getting in the EsPharma classes, please make point to point. This will help you as a quick revision before the exam. So maybe I'll ask Jyothi madam to give previous clipping batches notes also if anybody is written in good handwriting, but you prepare your own notes. By December 2025, I expect that every jewel batch student are exam ready. The only thing left from January to till May is that your revision and exam practice. So we are expecting very good ranks in GPAT 2026. I'm having a lot of expectations and hope on you people. And as I said, as a bridge between you and the faculty, I'll ready to give everything for you. Only thing is that you reciprocate the same thing from your side, that you are interested to learn the subject and you are aligning with your goal and your mindset, attitude, everything should be entirely different from the rest of your classmates. If you are with this goal, it is my responsibility. I'll take care that you will get very good rank in GPAT. Then, so be aligned to the EsPharma vision. Maybe Upendra sir will share more about our vision in the coming days. Learn the best subject, learn relaxedly, no need of any frustration, pressure, all those things. We have the best crowd this year. So I expect every one of you pay complete attention to the classes, and whatever you feel like, if it is really you are feeling like bored and not paying any attention, take break for 2 3 days, but come back strong. This is what I always tell to my drug inspector students also. If you are not willing to listen to the classes, take break. 2 days, 3 days, 4 days, whatever you feel like. But when you are coming back, don't cheat yourself. You pay 100% efforts to the classes, listen to the classes, and we'll be giving the recorded classes also with n number of views. So all these things you can listen well, practice exams, and based on that, we'll move forward. Right? So officially, we are marking it as today is the first class. Tomorrow is the Upendra sir class, and maybe 20 or 21st, we'll conduct more demo classes for other students. We are going to all the colleges to meet the principals and students. Some students may join by the month end. So whatever may be the thing, your actual schedule is July 5th till December 2025. Then we got the point. Any questions now? Or else I'll hand over session to Jyothi madam. Any questions you would like to ask? Fine. If the time permits, tomorrow I'll come, or else maybe next week I'll take separate GPAT attitude class for all the joint students, exclusively for Jugal's batch. We'll discuss more in that session. Done? Thank you. Thank you all. Over to you, please.
Yeah, good evening all. How are you? I need some responses.
Good evening, ma'am.
Yeah.
Good evening, ma'am. Fine, ma'am.
Yeah, fine, good. I'll share my screen. Yeah, welcome to GPAT 2026 Jewels batch. This is Jewels batch, right? You should shine like jewels. So this is the first class, and myself, I am Dr. Jyothi. Most of you know already, and I'll take care of entire academics in EsPharma education, and I'll take care of pharmaceutics subject also for this Jewels batch. So today I wanted to make this session, actually this is the first session, right? Few people have some hindrance, how we have to start the preparation. So where we have to start, how we have to start, and what are the books we have to read. And few people already they're asking me, what are the standard textbooks we have to study? Whether we have to study for each and every subject, we have to study like a different, for each and every topic, different textbooks we have to prefer, or like so many questions I'm getting. So I just wanted to ask sir, I'll take one orientation class first of all before starting the classes. Actual classes, I'll take orientation class so that we can start our actual classes also followed by. Okay, today I'll give entire orientation. If you are having any queries after my session also, you can ask me. And my only thing is you have to clear all your queries today, and have to start your actual preparation from today night itself, right? So today we'll start with actually what is the agenda of this webinar. I wanted to bring you like awareness about you people know about GPAT, you people know about NIPER, right? But still few are having some queries like why? Because in 2025 GPAT they didn't follow this some criteria. Okay, so few queries they have, few hindrance they have. Today we'll clear all those things. So what is this PG admissions? What is the criteria? What is the eligibility of this PG admissions? And what are the premier institutes you will get into admissions into which institutes and everything? And what is GPAT and what is NIPER? What are the eligibility and what are the marks? What is the exam pattern of GPAT and NIPER? Everything will study. And after that, followed by, I'll tell you how you have to start, right? So what is a preparation plan? We just, I did this, I followed few of this while I'm studying, and I took some things from Upendra sir. and few things from our, I have seen some rankers also, All India 4th rank, 100 rank, everything I have seen. So they used to tell me what they did and everything. So I just kept everything in the preparation plan. I'll give you entire preparation plan also today. So now, first of all, before starting, what is this PG courses? Many of you will tell what are the premier institutes. See, first of all, what do you mean by premier institutes? So do you people want to go premier institutes? Are you people want to go premier institutes? Right. So everybody's wish is to go premier institute, right? So for that, whether you're whatever, first of all, keep this premier institute aside. But I just wanted you please make a thought that like I have to clear GPAT, right? You at any cost you have to clear GPAT. Please keep that agenda or target into your mind, right? So you have to clear at any cost. You have to clear GPAT. That is not that much big examination. Okay, you can clear GPAT examination. We will tell you few tips. What is a pattern and everything we will tell you. So this year 2026, you will be having GPAT examination. Once you clear the GPAT examination, there are like total 7 NIPERs. I'll show you the NIPERs also, where it is located and everything I'll show you. So this immediately for writing, previously for writing NIPER examination, the qualification is you have to clear GPAT examination. But after this COVID and everything, everything got changed. So why? Because these people are getting delayed. GPAT people are doing some delay. Therefore, they are giving eligibility of writing NIPER examination to everybody. Everybody is writing NIPER examination. But those who qualify GPAT only are eligible for taking admission into NIPER exam. NIPER. Right. So there are like MS Pharm, MS specialization. There are specializations. Now they are categorized into MS and MTech. Right. Just give me a moment. Right. Sorry. So one better option, it is like NIPER. So after NIPER, you can also choose, apart from NIPER, you can choose IIT BHU, Punjab University. All these are like, I didn't kept everything, but some top 10 I kept, right? Apart from NIPER, you can choose BHU, Punjab University, Jamia Ahmedabad, DIPSAR, right? CSR institutions and some integrated courses also. So now this ICT Mumbai also, I don't know how many people researched on this ICT Mumbai. Those who got like very good rank, for example, our faculty Anand Busare is there. His rank is like All India rank 3, GPAT and All India rank 6 NIPER, right? So he is into ICT Mumbai. ICT Mumbai, like we are having so many branches, you can search about that. So apart from NIPER, you can do in all these premier institutes. All these are very, very like premier institutes, like and ICT Mumbai, and you have BITSAT examination also through BITS, through Manipal and NMIMS also. You can take your PG admission. So this is all about what you have to do or how you have to select your PG career. Okay. Any doubts in this slide? Any doubts in this slide? If you have any doubts, you can like keep it at last. We will discuss, right? So now coming to actual GPAT and NIPER preparation. So how I have to start the preparation, ma'am? So first of all, what books I have to refer? What are the important topics I have to refer? I have to cover. What are the important, again, in each subject, there are like few important topics. Today I'll clear everything about, especially I'm from Pharmaceutics. I asked different various faculty also, I'll ask them to give like what is the important topics you have to cover from each and every subject. Today I'll clear everything from Pharmaceutics point of view. What is more important from that subject and how you have to prepare and everything. So first of all, everybody of you have enough knowledge on GPAT pattern and NIPER pattern. I think yes, right? Okay. So once again, I'll tell you GPAT is like for 500 marks, 125 questions. Like the duration is 3 hours, 180 minutes, and 5 sections. Each section is like 25 questions, but this is like they implemented only this year. Actually, the 5 sections, they'll give one pattern from pharmacology, how many questions, from pharmaceutics, how many questions, but unfortunately, they didn't follow this time. But we are like expecting in 2026 examination this mistake won't repeat. They will give everything in prior only. Women's like the pattern what they are giving, that is the same thing they'll follow in the examination also. Each section like 5 sections, they'll be having 36 minutes. For each section they have given 36 minutes. Each positive question carry 4 marks, each negative question carry -1 mark. Okay, now coming to NIPER examination is totally for 200 questions. The total marks is for 100 marks, but this is varying. Sometimes they are keeping it for 100 marks. Sometimes they are giving it for 200 marks, right? This is like keep on changing, but like finally they are making it up to 100. That's okay. Okay. Duration is only 2 hours, but here, apart from our subject examination, they are giving some GK and aptitude also for 40 questions. 40 questions is for GK, aptitude, current affairs, what is going on, everything they'll give for 40 questions, and 160 questions is from our subject. Here, each correct question carries like, this is like I said, right? Based upon this is varying, but minus mark is for 0.25. As if this varies, this will vary. Okay, but this is like standard since when NTA is like implemented the examination, the pattern is same. 125 questions, each question carry 4 marks, each negative question carry 1 mark. Okay. Now, how to start your preparation? First of all, people are asking me, students are asking me, ma'am, we have to refer any standard textbook. Yes, obviously. Why? Because the biggest advantage with your batch means like yours is like not jewels. I'm not asking about jewels. Yours is long-term batch. Am I correct? Yours is like long-term batch. Hope I'm seeing so many joint students here. So please listen carefully. I request each and everyone to take some notes. Okay. So what to do? We'll like start from here. We'll start here. Please make a note of everything and follow few things what to do, so that it will be easy for us to move on for the entire year. Okay. First of all, we'll send you a syllabus in the WhatsApp group. Take that. Everyone, please carry a hard copy of the syllabus. Everyone, not the soft copy. Please don't maintain in your phone, on laptop or iPad. Nothing, right? Kindly, I request you people, everybody, please refer syllabus first and just take a printout. I just forgot to mention here. You please mention, write it in your books. It's like take printout, hard copy. I'll send you mostly by Monday. I'll be sending you a full detailed syllabus copy. I'll be sending you. Okay. So what you have to follow, what are the types of the books you have to follow for each and every text. I just kept textbooks also, standard textbooks also. If possible, I'll use the word not if possible, you have to read. Okay. Make a habit of reading a standard textbook. I know it is hard, but you are not writing a just normal examination. You are writing some GPAT. Then in GPAT examination only aptitude is there, right? So the questions, sometimes they're asking questions directly, but if the questions they're asking in an aptitude way, if you are reading, if you are following our lectures carefully, along with that, if you are reading textbook also, then only it will work, right? So at any cost, make a habit of reading standard textbook. So standard textbook also, not simultaneously. For example, if you are reading dosage forms, if you are reading rheology, okay. So after, for example, myself, I just like finished rheology. After just I covered all the classes. For example, if I have taken 3 classes or 4 classes for rheology, after my class, kindly take Alfred Martin, and again, once again, you refer everything from Martin, so that you will get 1 or 2 points new from the textbook, right? So that you can write it here. but like that, but make a habit of reading standard textbook at any cost. And fundamentals and basic concepts are very much. So in last Sunday, we kept parents meeting. From that, we got good suggestions also from parents. We are like following. We will take their suggestions at any cost. We will follow that. But my kind request is, for example, in entire B Pharmacy, there are like 40 subjects. In GPAT also, we are having more than some 30 plus subjects. 30 plus subjects, and we will like we will make it short. But explaining basics for each and every subject is like a big task for us. Why? Because we have to complete all the topics in a span of 6 months, right? So I request you people to thorough with the basics also from your end also, just like be thorough with the basics. That's why we gave warrior batch access, means GPAT 2025 access also. It will be there till 20-25 days. Will be giving you. Just be thorough with some topics, some basic concepts, so that like when you are doing with your actual classes, it will be good. Okay. Now, first thing is, just for example, I'll take one topic, rheology. If you are covering rheology, how you have to prepare is like our class notes, okay, plus any standard textbook, plus our materials. Okay. These three things will help you a lot. With these three things, you have to prepare a standard notes. Okay, you prepare a standard notes so that while going for the examinations, you have to refer only that standard notes. Means like tomorrow is your examination. Again, no need of taking entire standard textbooks, materials and everything. Just you have to keep it aside. You have to refer our class notes only, and few other things also there, what you have to refer and everything. So you have to refer your own notes. You have to prepare your own notes. Like a quick reference, you have to prepare a notes. Okay. Next, previous year questions. This will help you a lot. Previous year questions will help you a lot. And each and every question from the year 19, most probably from 2010 onwards, we will 2010 to 2025. Okay, so we will make you to practice each and every question paper. No worries about that. Why? Because I can ask you to take some book. Why? Because in Synapse also we kept all the previous year question papers, top subject wise. But there are few key mistakes in outside available previous year exclusively for previous year question papers. Books are available, but the only thing is there are so many mistakes, so many key mistakes. So myself and Upendra sir worked on each and every question paper. We worked on each and every question paper individually, and we uploaded in the site. Okay, we uploaded in our EsPharma education app, and we will conduct those examinations. Don't worry about that. So you can work on that. You can work on that. You can work a number of times, right? So it will help. Why? Because from this previous year question papers, at least 10% to 20%, like the same questions. I don't say the same questions will repeat, but there is like so much advantage of working previous year question papers. Okay, next, topic wise bits. For example, today sir covered diabetes. The next week he covered some like some other CVS topic, some other CNS topic, some other peripheral nervous system. So that every week, if we conducted topic wise examinations, you will get perfect of that particular examination. So don't miss writing previous year papers. Don't miss writing, especially topic wise. Topic wise will give you some confidence, right? A few people are very much like okay, topic wise, so okay, tarva chuddam. No, please don't keep that. Don't postpone the examinations. My kind request is time to time, please finish this topic wise examination. It will help you a lot. Okay, now as I said, like keep contact with some experts. Some expert means like I don't say keep in touch with myself, keep in touch with Upendra sir. Anyways, we are your faculty. We will be in touch with you. I'm telling that any GPAT experienced person from your end means like your senior, anyone, only one person. Okay, please don't talk to too many persons, right? Too many persons. Don't take suggestions from too many persons. If any one person, if he is giving any genuine suggestions, then you can ask like what you can do, like if it is required only, if it is required. And here I just wanted to add one point also. This worked with some of our new, batches in 21, 22 and 24 also. They used to talk a healthy relationship with their friends also. Okay, so they used to do group discussions. So sir also gave that idea. We will implement it if it is everything works well. If we'll implement that a group discussion among the students also. But if you any of your friend in EsPharma also, if you can talk to her, like you can ask the questions, but the healthy relationship. If it is like it is time taking, it is if no, don't talk. Okay. Next, start from basic chapters. Just directly, don't go directly into the main topics. I request you people to start from the basic. That's why I just we asked Deep Anmol sir also to start organic chemistry. Why? Because in organic chemistry you have to refer some basic nomenclatures, everything. He will start with this, and myself from pharmaceutics also I'll start with from very basic topics. I'll tell you how I'll take entire pharmaceutics this year. I'll tell you now. Okay, sir also, Upendra sir also, he'll cover pharmacology. Before pharmacology, he'll do with anatomy and physiology, followed by the pharmacology of that particular system, followed by medicinal chemistry of that particular system. So he will correlate all these three subjects, and he will take you forward. Okay. Now, I said, right, one standard textbook is okay. Especially for pharmacology, I'll show you the textbooks. But for few subjects, like referring one or two textbooks is also fine. Sometimes, not all the time. Sometimes it is like referring only one textbook will not work, but because few topics will be there from some other book also. So at that time, just if possible, you can refer. Right? As I said, like consult some expert if required only. Okay, if they are taking your time, just don't talk to anybody this entire year. So from this slide, I just wanted you people to take practice topic-wise examination, practice previous year question papers, refer at least one standard textbook. And first of all, directly don't go into the subject, just learn some basic concepts, and then you can. And one more thing, any institute, not only EsPharma education, any institute, I sincerely tell that nobody can cover entire BPharm syllabus. Okay, entire GPAT syllabus. Means like we will cover 80%, right? The thing is like you also have to work. This year I tell you how you people also have to work, right? In 21-22 I did that. I used to give suggestions also to all the students how you have to work from your side. Okay, so you have to work from your side also. I'll tell you that how you have to. Will you people work for 1 year? Will you people work? If we guide you properly, will you people work? Are you people ready to work for 1 year? 1 year, every time sir will tell that you have to do like Diksha and everything, right? 1 year, it will change your life, entire life. Why? Because now I am seeing, right, our students, they book tickets to various places. I'm very happy. Few people, they are going for Mohali, they are going for, it will give happiness to the parents, to us, to them as well, right? Okay, so you have to work for 1 year, and we are there here. Myself, I am there, and Uma Shankar sir is there, and our very much luck is that Upendra sir is there with us this year, this entire year. He'll guide you. He is our full-time faculty here. Okay. Now, so note down or mark the important concepts. Means what? Sometimes what they are doing, they are giving direct definitions. So you may wonder in GPAT. Sometimes I don't know why. Sometimes they are giving directly definitions. That's why when I'm starting any class, I'll give you definition. Definition means like is a bookish definition. Don't create your own definitions. Already it is like people set the definitions in the standard textbooks. So we will refer that definitions only. And units. don't like neglect units for everything. You have to units and dimensions, and there are few important theories, okay, like noise Whitney theory, Fick's laws and everything. There are like few theories, and for example in unit operations also we have few theories related to equipments. In physical pharmacy also we have equipments, and I'll speak more about pharmaceutics, don't mind, and you correlate this with all the other subjects also, okay. So you have to read theories and you have to memorize the formulas. And now the main thing is the success people from our institute, what they did is like they maintained the stick pads immediately when, as today morning, I myself and Upendra sir, we both were discussing while doing this presentation. He is telling, ma'am, what is the other tricks what you followed? Means I used to maintain the stick pads, right? Immediately what is getting into your mind? For example, you are reading some noise Whitney equation, some Stokes law. Just you immediately write. You make important points of that. You stick on some your. I last Sunday I asked parents to make a separate space for them. Okay, I know it may or may not possible to everybody, but just in your home only, just create a space for you. Okay, this year, and please ask um, parents, if you are telling like if you wanted to study, they'll just like they'll give you more luxury, right? Okay, so please create some space and just make it as your space, and you keep stick pads and just like you do, but you just like maintain everything. So important definitions, important dimensions, theories, formulas, you make everything as a stick pads and paste it. And every morning what you have to do is like every day once in a while you have to do. And for example in pharmaceutics you have Latin terms, in dosage forms. Now I will tell you, right, you have to make everything tabular forms. You stick every day once in a while you have to read all those things, right? Solve problems as much as possible. In postology, you have problematic part. In BPPK, you have problematic part. In unit operations also, you have few things you have to remember, right? And for example, in analysis, you have Woodford-Fisher rule, right? You have to solve as much as possible. You solve, right? You solve by using some tricks, right? I'll tell you while solving problematic part also. I'll tell you what are the tricks you have to follow, you have to maintain and everything, right? Now, this is very much important. Self-assessment is most important. For example, I ask you to do topic-wise examination. I ask you to do grand assessments, not grand assessment, previous year papers. Grand assessment and mock test we will keep after December. Okay. So while you're doing examination, you are maintaining all these things. You are referring standard textbooks, you are referring stick pads, you are referring everything. You are doing whatever we are telling, you are doing everything, and you are attempting the examination. For example, you got some less marks. You just analyze yourself. You analyze yourself. If you are not able to analyze yourself, you ask us, ma'am, why this marks is why I'm getting less marks in this paper, right? Okay. You got some, for example, in this examination, you got some 80%. In next examination, you got some 70%. Why just like this 10 marks, this 10%, why I'm lacking, what I'm lacking? Just my kind request is self-assessment. If you are not doing self-assessment, there is no chance of getting good score, getting the improvement and everything. So we'll do this. Surely we'll do this. This time, we kept this self-assessment. You have to do self-assessment, and we will also analyze each and every student from our end. Okay. Continue the self-assessment. I kept this as a point. Continue this self-assessment until you get by. For example, okay, this time you make more negative marking. Your marks went in more negative marking. Okay, next time how I have to do. Okay, I'll speak with ma'am, or I will do my self-assessment and I'll work in the next examination. Okay, so this is very much important. Solve more problems. I told you, discover more and more new tricks and tips. Why? Because this time I asked all the faculty to change the pattern. Why? Because I asked to keep how they have to remember. And this time personally, Shankar sir is like complete administration. He'll take care of entire administration. But this time sir said that he will involve in academic also. He will give more of this synonyms like everything. He'll give more of like handy notes He will send daily notes in the Telegram channel. Daily morning, he will send some quotations, right, in the group. Like that, he will be sending in the we are creating a separate Telegram channel, and just we wanted to send you. Are you people there? Are you people getting what I'm? Just you people there? Right.
Yes,
Okay. Okay. So we will be sending that. No. Now we'll go to, I'm thinking that I gave you enough things how to start and how to start, when to start the preparation, at the earliest, okay, immediately. By this time, you have to start your preparation, okay, by this time. You have to start your preparation, and at least you have to make, I asked you this one last Sunday, you have to pull 4 hours of your time, at least 4 to 5 hours of your time exclusively for GPAT preparation, okay? This is the thing, at any cost you have to do this at least 6 months. After that, you have to increase these timings. And if you are getting any holidays and everything, for example, any summer vacations or any vacation, any vacation they are giving in the college, complete time you have to spend on GPAT. Okay. Now, coming to GPAT focused subject, I said like there are totally there are 14 subjects you have to focus, you have to concentrate, or you have to study for GPAT in GPAT point of view. Among these 14 subjects, like 10 to 14 subjects, okay, 10 to 14 subjects, why I kept only these subjects. Don't think that only these subjects and there are no problem with the other subjects. No, you have to read other subjects also. They are called as minor subjects. You have to show partiality towards some subjects. In that, the first place goes to these 2 subjects. First place goes to only one subject, right? No, in GPAT, the first place goes to these 2 subjects, pharmacology and pharmaceutics. Okay. I'll talk separately about these 2 subjects. Next, pharmacognosy, analysis, and chemistry. Chemistries, we have so many chemistries here. So many chemistries like organic chemistry, inorganic chemistry, medicinal chemistry, physical chemistry, biochemistry. Did I left anything? Okay. Physical chemistry, inorganic chemistry, everything, all the chemistries. Okay. This will be taken care by Upendra sir, and these other subjects will be taken care by other faculties. Mostly biochemistry will be taken care by Laudu sir, and organic, inorganic, physical, everything will be taken care by Dr. Deep sir, Deep Anmol sir. Okay. Right. So please make sure that this chemistry subject is like a few people, they are having fear of chemistry. Don't keep chemistry phobia. Sir is I myself I am very much fear of actually chemistry part. But I heard Deep Anmol sir. How many people like attended Deep Anmol sir classes here? Anybody there already attended Deep Anmol sir classes? Right, you were there, right? Okay, so he will make your subject easy, clear. Okay. So now also you are having his classes in his organic chemistry classes, his physical chemistry classes. Once you can go through that, he will start his classes very soon, most probably from next week onwards. Okay. Now, pharmaceutical analysis is also one of the major subject. It is not a minor subject. Pharmaceutical analysis is a very major subject. Apart from after pharmacology and pharmaceutics, I'm coming in this way. Okay, not why, because these 2 are there is something important to talk about these subjects. That's why I kept it like a little later. Pharma analysis, you have to cover chromatography and spectroscopy. Just please cover chromatography and spectroscopy, all the chromatography techniques, all the spectroscopics. Okay. So apart from chromatography techniques and spectroscopies, you have to refer titrimetries. Titrimetries is important. Okay. Pharmacology, I'll show you each and every subject. I'll show you. But among all the subjects, please kindly give a good importance to pharmacology and pharmaceutics. For example, if you are keeping some 5 hours of time for your preparation, you just give 2.5 hours to these major subjects or 3 hours to these 2 subjects and remaining time to the other subjects, right? Understood? I hope you are I hope you're getting my points, right? I need some responses.
Yes, ma'am, we are
Yeah,
understanding.
this batch, we are discussing. All are very sharp. All are very sharp, and why? Because we are seeing in the group also, you're giving immediate responses, right? So you have to maintain that. So now we'll go each and every subject. Each and every subject, I don't know much about other subjects. I can talk fluently about pharmaceutics, but I have pulled I have asked topics from various faculties, and I kept some topics also, subtopics also. So pharmacology, 27 questions as per 2024 till 2024, 27 questions will come from pharmacology. This year also we got good questions from pharmacology. These are, I'll send you this PPT also in the group. These are some important topics. Sir gave this important topics, general pharmacology, ANS, CNS, CVS, apart from that, especially diabetes, autocoids, immunopharmacology, hematology, and I wrote everything. Of course, I wrote everything, but I wrote in some sequence, right? So you have to cover all these topics from pharmacology. Now, what are the books I have to refer from pharmacology? For example, sir will take class. Okay, you will send our materials. Okay. Apart from that, I request everyone, if it is okay for you, I request everyone to have KD Tripathi. KD Tripathi. This is like a newer edition, ninth edition. Need not necessarily to take 9th edition only. Just 8th edition is also fine. 7th edition is also fine. What will change is like mostly classifications is only will change. Why? Because few students have 7th edition also. Few students have 8th edition also. That will work. Okay. No, till now you haven't you bought any this like a textbook KD Tripathi means you can buy this 9th edition. That is fine. Why? Because this is like all-time book. If you're opting MS pharmacology also, this book will help you. Few people have habit of reading Rangendale. That is very good choice. Very good choice. If in your library, if you have Rangendale also, you can take this Rangendale and study. But very deep concept and very good subject, right? Apart from that, please have a handy of this classification of drugs. All the classification of drugs, KD Tripathi classification of drugs. A small book will be there. I think I'll ask sir whether we have soft copy or not. If not, if you can afford, you can take it, right? Again, I'm telling, if you can afford only, you can take it, right? So this is like KD Tripathi. For classifications also, we have small book for KD Tripathi, and anybody, ma'am, I can read more, like I can grasp more subject means you can refer this Rangendale also. Now, coming to pharmaceutics, entire pharmaceutics, we have 7 different subjects of pharmaceutics. After this entire thing, I'll give you an overview of pharmaceutics. Okay, I just kept a few topics here: pre-formulations, tablet, capsules, parenterals, mainly dosage forms, and some topics of like physical pharmacy, some topics of BPPK and everything. These are few important topics I just kept from pharmaceutics. So here, what are the important textbooks you have to refer for dosage forms? For dosage form technology, this is like Lackman and Lieberman. I don't know in your college what is the edition it is available. So if it is like this, I hope this is the edition. Now we have 4th edition also. But this is the most like commonly used book in the libraries. This is the old edition. Okay, this is a Alfred Martin for physical pharmacy. Alfred Martin. For pharmaceutical technology or dosage forms, you can refer Lackman and Lieberman. And for BPPK, Brahmankar, you can refer BPPK, Brahmankar. Okay. And for unit operations and cosmetic technology and pharmaceutics, dispensing pharmacy, my notes is more than sufficient for these topics also. And one more thing, before showing all these textbooks, I wanted to tell you an important thing. Few students, purely they'll rely on our coaching. Okay. those students who did like that, they are also succeeded. Means like they do, ma'am, now I can't do all these things. Why? Because like I have a lot of work to do from my college and also in home also. There are many things. I don't know all these things now. I can't refer all the means like you can, with our class notes also, with our materials also, you can get a good rank. But to get a top rank, these like referring standard textbooks are very much important, and you have to refer few things from your end also. Okay, like simply following our notes, our faculty, you will succeed. You will succeed. But to stand in a higher position, like to get in top 10, to get in top 100, to get in top 50, surely you have to refer standard textbooks. I hope you understood the value or the importance of standard textbook, right? No, ma'am, I can't refer all these things. Why? Because they're like Martin, Lackman, and everything. You can refer CVS. CVS physical pharmacy is there. CVS physical pharmaceutics is there. CVS unit operations is there. For all the pharmaceutic subjects, you have CVS. Yeah. Any queries? Any questions? Okay. Right. Okay. I'll tell you more about pharmaceutics after this. After telling the entire things, I'll tell you. Now, what about this? Just a minute. Yeah. What about this pharmacognosy? Pharmacognosy, always like I suggest coquette. I suggest coquette, and these are the few important topics: alkaloids, glycosides, volatile oils, tannins, carbohydrates, lipids, and biosynthesis pathways. Pharmacognosy. Pasha sir will handle this subject. He will make subject very clear. I know most a few students have attended his classes. Pharmacognosy. He will make subject very clear, and he will include medicinal chemistry also in pharmacognosy. Okay, I'm damn sure that nobody will teach pharmacognosy in that much depth. Okay, I'm sure. Why? Because I myself, I have seen some 6 or 7 pharmacognosy faculty. He is the one who will relate, and of course he is my GPAT faculty at that time. Okay, right. So for pharmacognosy, the best book is Coquette, but the standard textbook is Trees and Events. If you can refer Trees and Events, it is like awesome, right? No, ma'am, like I'm okay with this is also okay. This is also okay. Coquette is also very good book, and you will find each and every topic, alkaloids, glycosides, every topic of pharmacognosy, and there is no important things from Hamwai, because we have few topics only. All are important, right? Alkaloids are very much important, glycosides, volatile oils, and this one also we have discussed today. In GPAT 2025 paper, the standard questions came from pharmacognosy. Upendra sir is telling that the standard questions, we are not criticizing these other subjects, but standard questions, you can once again you can go through your response sheet. If anybody attempted exam, once you can go through the paper, standard questions came from pharmacognosy, right? So if you have to, otherwise you do one thing, you refer pharmacognosy, but once in a while, just once you go and see trees and events also. Okay. Now, pharmaceutical analysis, I said like you cover each and every spectroscopy technique. Most importantly, UV, visible, IR, infrared spectroscopy, right? NMR and mass. These 4 are very, very, very important. UV, IR, NMR, mass. Okay, and gas also. Gas chromatography and HPLC, HPTLC, gas. These 3 are important, right? So apart from this, techniques like some analytical techniques, conductometry, polarimetry, and everything, and titrimetric methods are also important. So you, in your colleges, I think most of the colleges, they are following this Shetwal, but this is a standard book. Pavia is a standard book, and Y.R. Sharma, and these are all few books. Why? Because why I wrote everything is like, I don't know you people are following this or not, but I will send you this. from now onwards, at least from now onwards, please make a habit of reading the standard textbooks. What is the advantage of reading the standard textbook is like, now you can tell, ma'am, we already came to this 4th year. Now we don't have time. Means no. You are in long-term batch one. You have some time. You have some time for reading those things. So provided you have to pull your time, at least 4 to 5 hours or at least 6 hours, you have to pull your time so that you will be finding time for reading all these textbooks. Okay. Organic chemistry, these are, sir will make you easy. Organic chemistry, don't worry about that. All the types of reactions, stereochemistries and isomerisms, everything. These are few important topics. I have seen sir videos and wrote a few important things here. And for organic chemistry, you can read Ball and Ball. Okay, Wilson, we used to refer Ball and Ball, and there is some other Morrison and Boyd, right? Morrison and Boyd. What is the textbook you will refer for organic chemistry? I just wanted you people to talk.
Ball and Ball, ma'am.
Ball and Ball, okay. Any other? No, you are not studying organic chemistry at all. Why? Because for medicinal chemistry, if you wanted to read medicinal chemistry, you have to learn the basic concepts of organic chemistry. Then only the medicinal chemistry subject will become easy. If you wanted to read in depth of pharmacology, if you are very much interested in pharmacology, you should know the basic concepts of anatomy and physiology. Right. So anatomy and physiology, again, Ross and Wilson. I forgot, I didn't keep there. Ross and Wilson is in standard textbook for anatomy and physiology. Sir will study from Tortora. Right, biochemistry, these are many things, but I kept these are the important things, and the standard textbook is U. Satyanarayana is sufficient for biochemistry. And physical chemistry, these are the topics, and standard textbooks are there, but just you follow our class notes, class material. We are sending you material, right? Sir, notes and material is sufficient, okay, for physical chemistry. Why? Because I'm not saying that many questions, but even though if you want to refer a standard textbook, all these topics, all the physical chemistry topics are there in Alfred Martin, okay? Now, microbiology, myself, apart from pharmaceutics, microbiology also I'll be telling you. In microbiology, the most important topics, the questions are coming from staining techniques, okay? And the microorganisms and antibiotics, this is an important topic, and sterilization. From these three topics, we are getting more questions, and type of bacteria, gram-positive bacteria and gram-negative bacteria. And the standard textbook is like Pelzer. I'll give you entire thing about microbiology. Don't worry about that. And I gave you everything in material also. In GPAT material also, we have everything about some 40-50 pages is there about microbiology. You can refer that. Now, so these are the important subjects. Apart from that, we have biotechnology. Apart from that, we have like a management subject, and we have biostats. Now, in 2025 GPAT, we got 3 questions from biostat. Am I correct? So 3 questions from biostat. So this is also important subject, and ma'am Lakshmi ma'am will take this subject this year, right? She is the HOD of one of the college. She'll take care of that subject. Okay. I think I covered most of the subjects, right? Now, key important areas. I kept everything. So key important areas: metabolisms, you read, clinical phase trials, all the clinical phase trials, IR absorption values. One tabular form is there. I'll send you. In our material also it is there. Synapse also it is there. IR absorption values, you have to get it by heart. You have to get. There are few things you have to get it by heart. I'll tell you. This year we kept an agenda that myself and Shankar sir, we both took both that we will make you to read. We will make you to study. Okay, at any cost, I'll make you to study this year. This year I'll concentrate more. Means last year I didn't. It's not like that I didn't concentrate. This year I'll be like a faculty only. I'll be like your faculty. Why? Because remaining all will be like a guest faculty. They'll come. They'll take classes. Okay, but I'll take care of everything. But provided you have to do the things, right? So we'll send you abbreviations. So please read, please stick somewhere just you read once in a while or once in a 2 days, once in a week, you read all the abbreviations. Okay, why? Because these abbreviations are very much important in NIPER point of view. Before going NIPER examination, I posted all the abbreviations in the group, right? Like that, scientists, fathers, names, and everything. All these are all important for NIPER examinations, right? No. Key important area. Actually, key important areas I have to keep for all the topics, all the subjects, but I kept only for, I have shown here partiality. Why? Because I don't know for key for other subjects. That's why I don't know, means I can't give bluntly. That's why I made key important areas for pharmaceutics only. You have to concentrate on posology, ICH guidelines. ICH guidelines will, if you are very much thorough with ICH guidelines, it will be useful for pharmaceutics. It will be useful for jurisprudence. Okay. It will be useful for few other subjects also. ICH guidelines, you have to, we'll send you the latest edition of ICH guidelines also. Posology. In posology, few people will neglect posology and prescription. Posology and prescription, why? Because they will neglect, they'll think that it is not a subject of GPAT. Actually not. But in 2020 and 2021 papers, they have given one question from prescription and one you can see after this class, you can watch 2021 and 2020 papers. They have asked 4 marks questions, very basic question, prescription and posology. And tablet defects, there will be a one tabular form. Tablet defects, what is mottling, what is the effects of mottling, like every cracking, what is the effects of cracking, right? Disintegration times, dissolution times, this timing, and but as per IP and as per USP, these timings are very much important. Means disintegration time. What is the disintegration time of uncoated tablet? What is the disintegration time of coated tablet? What is the unbuckled tablet? What is the all the disintegration times, all the dissolution times? What is the dissolution apparatus? What is the type 2 dissolution apparatus? Type 2 dissolution apparatus. Type 2 dissolution apparatus. Are you listening? Sleeping? How many of you are sleeping here? Don't know? Type 2 dissolution apparatus. Basket or paddle?
Basket.
Pedal, ma'am.
Okay, either basket or paddle. Okay, right. Once you go through that, that is very much important. And there are like type 1, type 2, type 3, type 4. As per USP, there are like other things. You have to refer all these things. And evaluation tests for each and every dosage forms. There are like dosage forms. I'll tell you now what are the dosage forms you have to cover. For each and every dosage forms, the evaluation parameters you have to read. Solubility parameter ranges, which is sparingly soluble, which is like most soluble. The question they have asked in this exam, flow properties, right? How many flow properties are there? Angle of repose, Carr's index, bulk density, tab density, Houns's ratio, all these things you have to be very thorough with all these things. Pharmaceutical equations, units, stalagmometer, viscometer, sterilization and disinfection. And one more thing, sterilization and disinfection is not purely a microbiology subject, is not purely a pharmaceutic subject. It's like a wherever we need neatness, wherever we need sterility, you have to sterilization comes into picture, right? Sterilization is a topic of microbiology, is a topic of physics. It's a combined topic. Okay, aseptic parameters you have to read. Okay, HLB scale. HLB scale ranges from. Otherwise, who introduced HLB scale?
Sorensen.
Sorensen. HLB scale. Who told Sorensen? I think so well. HLB. Griffith. Right. Okay, so what is HLB scale? What is the purpose of HLB scale and what is the units of HLB scale, right? 0 to 20 units, and the range is also you have to read, and qualitative properties are very much important. Okay. Now, this is all about GPAT examination. Okay. Any doubts still here? GPAT, what you have to study, how you have to study, what are the books you have to study? Any doubts you can ask me till here.
Ma'am,
Yes, ma'am.
Ma'am, in the slide of microbiology, the standard textbook is mentioned as
Yeah,
Pelzer and
Pelzer.
Tortora.
This is like, no, just like
Here,
I just,
okay.
you can refer Pelzer. It is sufficient. Okay. It's like Tortora and Bentley's is like for other. I just like Bentley's. In Bentley's, sterilization topic will be good. Okay. So in that point of view, I just wrote all the things, but don't get confused. That's why I just like marked here. Pelzer is sufficient. Okay. Pelzer
No,
is
ma'am,
sufficient.
is Tortora the same book that we
Yeah,
refer
yeah.
for HF?
Tortora is same book. I have seen few topics also here. I kept, that's why I kept here, but okay, that's okay. Just like ignore these all textbooks. Pelzer is sufficient. Moreover than Pelzer, my notes is sufficient. Okay. And our class, our EsPharma education material is sufficient, and Synapse also have given good things. So for why? Because from microbiology, just we are expecting questions. Hardly we are expecting some 3-4 questions. That's it, right? So our textbooks and our materials, my class notes is sufficient, right? If you wanted to refer, you can refer Pelzer. Okay. Any other questions? If not, we'll move to NIPER. Okay. So don't, you have to get a good rank in GPAT, but your aim is placing in NIPER. Your aim is placing in some premier institute, BHU. Your aim is just keep an aim, just like write a vision board. Kindly maintain a vision board. Please write whatever rank you wanted to get. You wanted to get AR1. Please write it. Write it. Just like create an image. Create an image in NIPER Mohali. Just like paste it. See it daily morning. You visualize it. All the classes, Shankar sir will be telling. I'm not expert in that, right? But just kindly create your own vision board today itself. Kindly create today itself. Tomorrow you make, you just like take pictures of that. Tomorrow is Sunday. You paste it on your wall. Okay. So NIPER examination courses like now they kept is like 2 sessions, right? MTech and MPharm. And few people, they will write for PhD courses also. PhD also, they'll write this GPAT, NIPER and everything. Okay. Now the pattern is already we discussed 200 questions, total 100 marks. And the duration is 122 hours. We have both GK aptitude, and don't worry about this. Those who are joining with us for GPAT, we are giving free NIPER coaching as well. Okay, free NIPER coaching means if you are joining now, you will be there with us till 2026 NIPER examination, right? And one more thing I wanted to tell you. Anyways, few people, most of here I'm seeing the joint students and new students are also there here. I suggest anyways you will start your preparation. Anyways, you are like willing to start your preparation. With my experience, I am telling you that those who have joined for example, you take the statistics of 21 Indraja batch, Indraja 20, she is all India rank 4. Okay, Kinnera batch, she already took a webinar recently. Okay, and after that, Geetanjali students, right? So all the batches, I'm seeing the statistics. Those who have joined for the long-term batch 1, they are securing more ranks. For example, if we are getting a rank, for example, if you are getting 60 ranks, out of 60 ranks, 48 ranks are from long-term batch 1. 48 top ranks. You can see at the back of your materials. If anybody received your materials, you can see at the back of your materials, 48 ranks. They are from long-term batch 1. Why means why? What is the specialty of? We have much time to take like to show them a special attention, special care, and they have much time. You have much time, right? And we don't know, you people will get busy in 4-2 semester examination. So I request you people, that's why this year we kept a target of finishing entire syllabus by December. Okay. And from December, ma'am, what I have to do from December means you will be having examinations, all the examination. But apart from that, we'll be having long-term 2. You can attend these classes also. Short term, if you're having time, you can attend short term. So please don't think that I'll join for long term batch 1, but I'll try to attend long term batch 2. No. Those who are attending long term batch 1, total classes, they are only having access for attending this long term batch 2. Okay, right. So this is a pattern of NIPER examination. No, there are totally how many NIPERs in India?
7, ma'am.
There are total 7 NIPERs in India. There are total 7 NIPERs. The first NIPER is in NIPER Mohali. Everybody's dream is that they wanted to move Mohali, NIPER Mohali, right? But in ranking wise, our NIPER is NIPER Hyderabad is in good ranking. Okay, so one NIPER, Hyderabad NIPER. Have you seen anybody? So in Hyderabad also we have NIPER in IDPL, right? And I'll show you where are the other NIPERs also. It's like life is different in NIPER, life is different in BHU, life is different in ICT Mumbai, right? Okay, this is some photos which our students have sent. So there are like total 7 NIPERs. One is in Sasnagar, the main NIPER, Mohali. The another one is like our NIPER, NIPER Hyderabad, NIPER Ahmedabad. These 3 are like top. Okay. I'm not giving ranking. I'm not giving ranking. Just they have already given ranking by NRF ranking. Okay. Next is like Hajipur, Kolkata, Guwahati, and Raebareli. Right. There are like total 7 NIPERs in all over India. Now, why GPAT is important? By the way, all of you know what is the importance of GPAT. Few people, they'll ask me, what is, ma'am, we have to do job after B Pharmacy, we have to do job. We have to, like, my parents can't afford. We cannot do higher studies. GPAT is not, MPharm is not a higher study. It is your responsibility. It is not a higher study, by the way, right? Children, please remember that. Okay. So, but if the conditions are not good in your, like, why? Because it will vary. It will vary. The conditions will vary from house to house and like person to person, right? So, this is a very good opportunity for you. It is like studying, earning while studying, right? You will earn 12,400 rupees monthly while studying, right? Apart from that, you will have your hostel facilities and everything. It will not. This 12,400 is different, right? Those all things you will get for free, or there is some charge. That's it, right? And eligibility, you're eligible for writing GPAT NIPER examination. This scorecard is valid for 3 years. And you can join in some of the reputed institutes. And this GPAT scorecard I gave you already. I gave you examples several times in several seminars. I gave you recently our student who scored, who got a good rank in GPAT 2018 batch student. She got admission in NIT Warangal in 2025. Hence, that is this GPAT, it is like a scorecard, GPAT validity. It is like you can use in your resume. Adding, it is an added advantage in your resume, right? You have a quality of life. Okay, now cracking GPAT NIPER with EsPharma education. So I'll tell you the batch details of this Jewels batch. Then I'll go for this a detailed discussion of pharmaceutics. So this is like a hybrid coaching. Hybrid coaching means all weekdays you will be having online classes, or not all. This week, for this long-term batch one, for example, Monday you will be having week off. Weekdays you will be having 3 or 4 classes. And any weekday you will be having examination, one exam, topic wise exam or grand assessments or previous year question papers. And Sunday you will be having either full day or half day, most probably 6 hours classes, or like 4 to 6 hours classes, right? And this Sunday classes, we wanted to make it like hybrid. Hybrid means those who are in Hyderabad, we just wanted to call them on Sundays, okay? And totally we are getting 400 plus hours from July till December. And we will conduct 100 mock examinations along with our 4 papers, for printed volume study materials. We will send you this time. I said, right, Shankar sir, we 3 of us we discussing today. Sir gave me a word that he will involve this year in preparing materials. In preparing materials means, sir, you know, Shankar sir will prepare easy materials. So which is like, sir took some 3 classes of jurisprudence. And some four questions they have asked. Some 2 questions means 8 marks. 8 marks, right? He will prepare some simple mnemonics and everything, and he'll post it in Telegram channels, right? We have expert faculty, and most of this year, most of the topic will be handled by Upendra sir, and myself. I'll take care of most part of pharmaceutics, right? So we have our dedicated app, EsPharma Education app, and 4 volumes will be couriered to your house address. Those who are in Hyderabad, they can come and collect. And we are giving free NIPER coaching also, those who qualified GPAT. Right, I don't talk much about fees. You can contact me on the number, on this number. Okay, this is like my number. First number is with me, and second number is with Shankar sir. You can contact us, and this is our office address. Right? Any doubts still here? If not, we'll go to subject discussion of pharmaceutics. Any doubts? Any sort of doubt, subject like regarding textbooks, related to anything related to coaching. My number is, again, I'm texting my number 62224. And one more request. This year, I wanted to make you a request that kindly try to switch on your videos, right? While listening classes, try to switch on your videos so that just not today. Why? Because this is like short time notice. Just I request you people to switch on your videos so that like we'll be having some interaction with the students also. Right? I hope no doubt still here. And I need responses also. This year, like we wanted you people to talk more. Any doubts? No, yes.
No, ma'am.
Others? Andrea, Balu, Bhagya, Harini,
No, ma'am.
Josh, Ria, right. Okay. So now we'll go forward. Can you able to see my screen?
Yes, ma'am.
Yes. So my specialization is pharmaceutics. Okay, so till 2024 GPAT, I'm not very clear about 25 GPAT question distribution, but till 2024 GPAT, I'm very sure that from pharmaceutics, they used to give 38 questions. 38 questions only from the pharmaceutics subject. This time also we got more than 30. More than 30 means 30 questions means what is a, or how many marks you, if you are like just keeping only pharmaceutics subject, like all correct, how many marks you can score? At least you can score more than 150. Okay, 150 score. Don't think that you can read only pharmaceutics and go, right? So from this pharmaceutics subject is categorized into 7 sub-subjects, 7 sub-subjects, 7 sub-subjects. Okay, so in the first year of pharmaceutics, in the first year of B Pharmacy, you know, do you remember dispensing pharmacy? Dispensing pharmacy. And I hope you people don't know this name by dispensing pharmacy. You know, in first year B Pharmacy, you have the subject called pharmaceutics. Okay, this is like first year subject. And what are the topics you have to read here? What are the topics you have to read from this pharmaceutics subject is like prescription, posology, incompatibility, okay, if time permits, no, this is important topic, pharmacopoeia. If time permits, we'll see extraction also, extraction methods. Right. So among all these things, please keep a star mark near this posology. Why? Because they are asking direct questions from these allegation method problems, right? So how many types of incompatibilities are there? There are three types of incompatibilities: physical incompatibility, chemical incompatibility, and therapeutic incompatibility, right? So from that incompatibility also, they may or may not ask questions directly, but this knowing, studying incompatibilities in detail is very much required, because this you can apply in some few places of our entire coaching, right? Because you should know in while studying pharmacology also, while studying few drugs also, you can implement this if you are very much thorough with this incompatibility subtopic. So you can apply there, right? So prescription. In prescription, so what are the, like they are giving direct questions from these Latin terms. So I'll tell you, there are nearly 1,000 Latin terms are there. Okay, but will you read that 1,000 Latin terms? If you read, can you able to remember that 1,000 Latin terms? No, right? So among that, some 250 Latin terms are very much required, important, and I'll tell you how to remember those. Like we will study, for example, one day we will study the Latin terms related to dosage forms. One day we will study the Latin terms related to route of administrations. I'll tell you how to read and how to memorize each and every Latin term. I'll tell you that. Okay. So pharmacopoeias. Now currently, which edition of pharmacopoeia is currently we are using which edition of pharmacopoeia? Latest edition of pharmacopoeia. Have you seen pharmacopoeia? No. Currently, which edition of pharmacopoeia? We have to study. You have to work a lot. You have to work a lot. We will work a lot, right?
2014.
Okay. 2014. Okay. Any answers? Currently, which edition of pharmacopoeia? 2022. Which edition? Yes, 9th edition of pharmacopoeia.
9th edition.
Currently, the 9th edition. Can you people type it in the chat box? 9th edition. Everybody. Vishnupriya, Shubhashri, Sohail already. Sohail gave the answer, right? Shilpa, Harini, Rohit. Don't mind my class. In my class, you have to just be interactive. You have to be interactive. Then only I'll move forward, right? 9th edition. Now you will you people forget 9th edition, right? 9th edition published in the year. 9th edition published in the year
2022.
2022. Most probably you can just switch on your cameras as well as live mic. You can tell the answer. Okay, right? 2022. 9th edition. Okay, so this is 8th edition, and especially there are each and every country have their own pharmacopoeia, but we have to study as we are in India, and the questions are coming from only Indian pharmacopoeia. We will concentrate much on Indian pharmacopoeia, starting from the 1st edition of Indian pharmacopoeia till the 9th edition of pharmacopoeia. And one more question: when was the 1st edition of Indian pharmacopoeia was published? When was the 1st edition of Indian pharmacopoeia was published? Oh my God. You're searching, don't search anything, right? If you know the answer, tell me. If not, yeah, 1955. 1955, 1st edition. Everybody, 1955. Type it in the chat box, 1955. While we are studying pharmacopoeia, it will be like a fun. Why? Because you have to remember 40 years. Years means years, real years. Okay. 40 years. Means different years. Okay, you have to remember. Okay, we'll study that. So this is one subject. This is very easy subject. Okay, but not that much important subject. Okay, but what is the important subjects in pharmaceutics? You have to show, as I said, 7 important subjects in pharmaceutics, but you have to show partiality as among all the subjects. You have to, as I said, like you have to show partiality on pharmacology and pharmaceutics. sorry, in entire pharmaceutics also, you have to show partiality on few subjects. That is, first one is physical pharmacy. Please write if you are having, how many are writing? How many are writing? Pharmaceutical technology means how many are like taking down the notes? Writing means taking down the notes. Pharmaceutical technology is nothing but dosage forms. Please take down the notes. Please don't miss any class. And BPPK, biopharmaceutics and pharmacokinetics, right? And next followed by our remaining subjects like pharmaceutical unit operations, means engineering. Okay. Next important subject is like dispensing pharmacy, means pharmaceutics. Next important subject, NDDS. Next, cosmetic technology. But so here, the most of the questions, if you have gone through or if you have written already the examinations, means you can like have a 2025 examination also. From pharmaceutics, they'll ask more questions. They'll ask more questions, right? So first of all, I'll start with physical pharmacy. But what I'll do is for the first week, why? Because few people still they are joining, right? So we'll do with some easy subject. Some easy subject means like I'll do with either with cosmetic technology or dispensing pharmacy. I'll to make you some interesting. Physical pharmacy is also very important subject, but it is like very, very, very important, very interesting subject, but very important subject. So again, in physical pharmacy, what are the topics you have to read this? You have to read rheology. Okay. Interfacial phenomena. Next one, colloidal dispersion, coarse dispersions. This rheology, interfacial phenomena, and coarse dispersions. These three are like, what is the beauty of these three topics is like, all the other subjects in pharmaceutics have interrelation with this, these three topics. For example, if we are studying tablets. Okay, tablets is from not this physical pharmacy, it is from pharmaceutical technology. Okay, so for example, in weight variation, for example, I'm studying weight variation. In weight variation, there is like defect or in some filling properties there. Some filling is not happened properly. Filling is not happened properly means what? That is a problem of what? There is a problem of it is not filled properly. Why it is not filled properly? It is the powder is not flowed properly. Why it is a problem of what? It is a problem of flow property. Again, flow property comes under which subject? The flow property comes under this micromeritics. Okay. Yes. Physical pharmacy. Flow property again comes under this physical pharmacy. Okay. So this physical pharmacy, why I am telling I'll start with physical pharmacy is this physical pharmacy has a relation, as an interrelation with all the other subjects. For example, we are studying suspensions and emulsions from dosage forms. These suspensions and some emulsions, for example, coming to this viscosity. Viscosity means studying viscosity, studying flow properties is called as studying something about fluids. Again, related to rheology, right? So if you study rheology, if you get some good concept of rheology, good concept of interfacial phenomena, and good concept of coarse dispersions and colloidal dispersions, you can do other things very easily. Okay, other things very easily. That's why we'll start with the physical pharmacy. Apart from there is physical pharmacy is like a big subject. Okay, but in that also you have to make sure that you can pull some important topics which is very much useful for GPAT point of view. Rheology, interfacial phenomena, coarse dispersions and colloidal dispersions. Micromeritics. And there are few things like chemical kinetics. Okay, buffers, pH buffers and everything are there, but these first three are very much important. Okay. Next, coming to this dosage form technology, this dosage form technology means entire all the dosage forms. For example, there are like nearly in the market 50 different types of dosage forms are there. Not all the dosage forms are very much important, right? Not all the dosage forms are very much important. There are like some 14 dosage forms are there, which you have to study in detail. So dosage forms are again divided into solid dosage form, liquid dosage form, semi-solid dosage forms, and aerosols, gaseous dosage form. Again, in solid dosage forms, if you count, there are like several dosage forms. But again, in solid dosage forms, we'll concentrate. I'll tell you a detailed tabular form of dosage forms. But among those dosage forms, you have to read perfectly about only 14 dosage forms. For example, from solid dosage forms, tablets and capsules. From liquid dosage forms, it's again categorized into monophasic liquid dosage forms and biphasic liquid dosage forms. Monophasic liquid dosage forms, not much questions are asking from monophasic liquid dosage forms. You have to, I'll tell you overview of monophasic liquid dosage forms. But biphasic liquid dosage forms, suspensions and emulsions, a lot of questions are asking, right? Next, coming to semi-solid dosage forms, like you have to concentrate on ointments, and next you have to concentrate on suppositories, next followed by aerosols. Okay. Next, these are the few topics from pharmaceutical technology dosage forms. Now coming to BPPK. So in BPPK, BPPK is also a good subject, but it is not that important as physical pharmacy and dosage forms, but they're asking good questions, good number of questions from compartment models. Have you studied compartment models? Compartmental models, right? Compartment models. So you have to concentrate on absorption, physicochemical properties of absorptions, physicochemical properties. You have to study on physicochemical properties, and these two, we'll study these two, it will be sufficient. If still there are any other things, I'll tell you. Right, these three subjects you have to read like anything. You have to read like anything, end to end. There is no option in these three subjects, right? Whatever I'm telling, like this is important, you have to read, right? And unit operations. Coming to unit operations, there are like each and every unit, single unit operation. For example, drying is a unit operation. Size reduction is a unit operation. Size separation is unit operation. Crystallization, evaporation, distillation. All these things, studying all the unit operations is difficult. That's why in our material, what I did is like we created like a tabular forms. Just like I have given study. I'll tell you the concept of each and every unit operation. For example, what is the concept involved in drying? What's the concept involved in size reduction? What are the principles that are involved in size separation? Everything, right? And after that, I'll tell you how to study each and every equipment. Why? Because explaining each and every equipment will take a lot of time, but the questions are coming from this equipment and principle. Okay, I'll tell you how you have to study those things, right? Next, coming to dispensing pharmacy, I told you, right? I'll make you practice like anything. Posology, entire posology calculations, you will make you practice. I'll make you practice like anything. You have to attend, and everybody should on your cameras in that class. At any cost, you have to on your cameras. Okay. For example, in posology, we'll cover about dosage form calculations, dosage calculations of children's. Okay. Alligation method. Today, actually, I thought of starting class. It's already 8 o'clock, right? Dosage calculations. Okay. Next, coming to proof spirit calculations, we'll do. Isotonicity, methods of adjusting isotonicity problems. The question came from this, right? These few are very much important. We'll solve this, right? Cosmetic technology, you know, there are several cosmetics, right? But we cannot cover all the cosmetics. I'll cover most importantly, any 5 important cosmetics, right? Like lipsticks, hair preparations, nail preparations, and Any skin preparations, okay. Any 5 very important, okay, which is most frequently asked. And novel drug delivery system is like, we'll keep it at last. We'll keep it at last. Why? Because questions are like not frequently asking from NDDS. If even though they're asking, they're covering this like controlled drug delivery system and targeted drug delivery system. We'll see overview of those controlled and targeted. Okay, this is all about. I'm telling you have to cover everything in GPAT point of view, but pharmacology and pharmaceutics, if you give a good importance, you have to give importance for all other subjects also. But these 2 subjects will carry a major part, means 50 to 55% of your GPAT is from these 2 subjects. Right? Any doubts? Any doubts? Yeah. My request is like all are joint students, and mostly 4 or 5 members I'm seeing outside students. Today onwards, we'll start our mission. This is, keep it as a mission. How many of you want a rank below 100? I asked below 100. Immediately you have to respond. Right? Immediately you have to respond, sir. Will right? You just keep a target. You are getting, and keep visualize. If you can able to get up and at 3 o'clock, just wake up at 3 o'clock, just do 10 minutes of affirmation, and again you sleep, go for bed. Okay, not an issue, but just a good affirmation of that you are already, you got some all India top rank. You are going into premier institutes, what I have shown you. So many premier institutes are there. Select your desired premier institute. Keep it in your mind. Okay, just keep on affirmation. Keep on doing enough affirmations on that. But, definitely you will be getting, and we'll work together. Together we'll work. But my kind request is, after each and every class, you have to work. You have to work extra time. For example, if I am telling rheology, again you have to go and study Alfred Martin. Okay, that is very much important. Studying standard textbook is, myself, I am referring entire Alfred Martin. I am studying Martin, and I'll tell classes from Martin only. Okay, even though after my class, if you refer Martin, if you refer Lieberman and Lachman, it will be like an added additional advantage you will be getting. For example, I may forget 1 or 2 points, right? So that you can capture from those classes, right? And my kind request is, kindly refer your friends. Don't think that they are your competitors. Okay, no, not like that. Just refer your friends. Why? Because they may from different categories. They are in need. So many of your friends are in need. Refer. It will be help them. It will be help as well for us also. Okay. Yes. Any doubts? And from tomorrow onwards, like actually today I wanted to start a session already. It's like 8:10. Next week, tomorrow we are having 3-hour session of pharmacology. You can you can ask your friends also to join those who are new to this classes. You can send them a link also. And Monday you don't have class. Monday will take a week off every Monday. And Tuesday, I said that most probably this week I'll be taking 2-3 classes. As I said, this week we'll do with a small subject, and we'll keep it aside. Why? Because one thing is few people are joining. That is a one thing. If I start the major subject of physical pharmacy, then they'll miss the classes, right? That is a one thing, but I'll make you interesting. And if all the faculty's feedback, you can give it to me. Why? Because I'll take care of entire academics in EsPharma education. If my feedback, my class feedback, if you want, you can give it to me. If not, you can give to Uma Shankar sir. Right? Any doubts? Any sort of doubts, any sort related to textbooks, any sort of doubts related to what is the material, from where we have to cover, Any doubts you can ask me. So if possible, you get a book of KD Tripathi. If not, you get it from library and from physical pharmacy, Martin. And for you have to study. You have to study. There is no other option. Just study, enjoy the process and study. It will be very easy. If you enjoy the process and study, it will be very easy, right? So any doubt of any sort of questions, you can reach out me. You are having my number. Most of you are having my number, my personal number also. If not, this is my office number, 90300-68824. Those who have joined today and wanted to take the coaching with us, you can contact us on that number. Okay, then if you are not having any doubts, like I'll see you in the next class, right? Okay, take care. Now, please tell me how many hours you can pull from today onwards. Are you starting your preparation from today? Still any postponements are there? Are you starting your preparation? GPAT preparation. And one more thing, one important point I wanted to tell you, even though if you are having semester examinations, even though you are having mid examinations, I cleared you this point last week. I cleared you this point very clearly in the last week. Don't relate GPAT examination with any sort of examinations, any sort. So many examinations will come your way, right? So many examinations. Don't like. Yeah. So, just ma'am, we are having semester examinations. Few people will ask moving forward. Few people will ask to give break. As I said, if I'm now, I can give break now. But once we started classes seriously, we cannot give break. Why? Because the flow you will miss the flow, right? You will miss the flow. So don't keep any connection with this GPAT examinations, right? GPAT preparation. Okay. Right. I hope no queries, right? Okay. I hope you are starting your preparation, serious preparation from today onwards. And tomorrow, each and everyone attend Upendra sir live classes. As I said, this year we are not going to provide live classes, recording classes immediately. I'll give you. Don't worry, I'll give you, but not immediately. Why? Because you are missing, you are not attending record live. You may or may not attend live classes. That's why this year I wanted to give little later. Okay. Everybody, I wanted to see you in the live classes. Okay. Okay, then take care. Right. Have good food, good sleep. See you in the next week, means next class. Right? Take care. Bye-bye.